So we're looking at a community-level intervention that, again, is targeting and trying to change social norms. It can be used with a variety of at-risk populations in a variety of venues as well. It was actually tested with multiple populations, specifically with gay men in bars, African-American women in low-income housing, and male commercial sex workers. POL works with opinion leaders from those populations to encourage safer sex norms. So the theory and evidence behind it, this also is based on the diffusion of innovations theory that, again, says behavior trends, typically and predictably follow the adoption of opinion leaders. And we saw this really clearly, actually, through the D-UP training. When you actually go out and watch groups or social networks of people, you can see people actually, listening to these opinion leaders, even little things. The evidence that they found was that it significantly reduced unprotected anal intercourse, reduced number of sexual partners, and it also increased condom use among participants. So the core elements for POL, it's directed at an identifiable target population in very well-defined community venues. So as you noticed, the 3 groups that it was studied with were very specific. Gay men in bars, African-American women in low-income housing. So it works best when it's very targeted. Ethnographic techniques used to find the persons who were popular, well-liked, or trusted. They actually used techniques for that. Over the life of the program, 15% of the target population size found in the venues get trained as popular opinion leaders. So a big part of the program is to go and find these people to train and use as peers. You teach the popular opinion leaders skills for initiating informal risk reduction messages to their friends and acquaintances. And actually, D-UP is neat because although we're not highlighting it today, it's an adaptation of POL for young MSM. And so it does the same thing. It tries to get people to take messages informally back into their own social networks. Some more core elements of POL. It teaches popular opinion leaders characteristics of effective behavior change messages, targeting risk reduction attitudes, norms, intentions, and also self-efficacy. Groups of popular opinion leaders meet weekly in sessions that use instruction, some modeling from the facilitators, and there's extensive role plays and exercises to help the POLs refine their skills before they're sent off to do the work. POLs also set goals to engage in risk reduction conversations with their friends and their acquaintances, so they actually have a certain number that they're expected to go out and talk with. Popular opinion leaders' conversational outcomes are reviewed, discussed, and reinforced during training sessions. And then another part of it is that logos and symbols and other things are used as conversation starters between popular opinion leaders and others. So they might develop some tool to bring out with them to use as a method of engaging people in conversation. Okay, so now I'm going to ask Brian King. He's the Director of HIV Prevention and Education at Health and Education Services Incorporated in Massachusetts, to talk to you about their experience with popular opinion leader.
Thank you so much. Happy to be here. I love popular opinion leader, and my staff do too, but it wasn't always so I want to put that out there too. A little background, I work for Health and Education Services, which is a very large human services agency in Massachusetts. We cover Essex County, which is north of Boston, in a pretty wide county. And the program is actually called the Gay and Bi Men's Health Program. It's been in existence for 15 years. We're funded by the Department of Public Health, Massachusetts, to do HIV, STD prevention with gay men, bi men, MSM, transgender men. And we're actually now in the process of changing our name to PRISM, which is more inclusive of all of those folks that we're in contact with. I'm the director, Brian, as you heard, and this is Kirsten, the condom queen. She is one of our outreach workers. everyone seems to know who Kirsten is if you live on the North Shore and are in the gay community. She's everywhere. And then the other full-time outreach worker is Ken, or Blanche Debris. She's not always Blanche, but that's how she's recognized instantly. We thought branding them is a really good way of people recognize them in the community. So the strength of our program has always been being really consistent and very present in the community in multiple places. We do outreach at bars, clubs, sex parties, private parties, on the internet, public sex environments, and everything in between. And that's really important, which poised us to do POL, I think, is because we had established relationships in all these venues with bar owners, bartenders, the mayors of the cruising area. All those guys know these folks. And what is really helpful is that they might see Ken in a public sex environment or at a sex party giving out condoms or hanging out in the kitchen talking to people, and then they see him in front of the bar and we're doing a van, you know, a testing van like Sam was mentioning, and they say, oh, they trust him because they saw him in that place too. They think he's not just some guy from some agency who's coming here just for this one night and we'll never see him again. So he has a sense of who this person is. Another thing that has been a strength of our program is innovation. We love to try new things, and often the state uses us as their guinea pig. So we were the first in the state to do outreach at sex parties in Massachusetts. We were actually, I think Stefan would say, we're the first in the world to do HIV outreach on Manhunt. And then we were also the first in the state to do the testing van. We coordinated with Northeastern University to do that. And now it's a statewide program, which is fantastic. But we used to have her like once a month, and now we have her twice a year because everyone wants her, you know. But well, here's a little thing about the van. So, as you all know, I mean, the CDC recommends or mandates that we do EBBIs and DEBBIs, and that was obviously an issue when you're, you know, doing things a certain way, and you're like, why do we have to do this now? So, you know, it wasn't necessarily easy. We tried Community Promise, which involves collecting risk reduction success stories from men, printing the stories, then training peer advocates to distribute and talk about the stories with the target community. It didn't really work well for us, but the idea of sharing stories we thought would work really well. So, and Popular Opinion Leader incorporates that, and that's a huge part of it. And what we liked about it was that people are sharing their own stories. Their risk reduction messages are really based on their own experiences. So it's a pretty valuable tool for fostering a sense of community because people are sharing their own successes. Another thing is that we really believe in the harm reduction philosophy and assets-based approach. We really try to avoid any sort of language that stigmatizes gay sex or shames same-sex desire. And I think a lot of people, especially the guys we work with, have a history of saying, okay, unsafe sex is equated with the shame about my sexuality. It's easy to put those things together. So we try to be very focused to help guys differentiate that. And what I really liked about POL is that it's really focused on assets-based. And it can be because it's so adaptable that you really can do anything you want with it. The core components are basically recruit people who are popular. We already knew the population very, very well, so we knew who was popular. So recruitment wasn't an issue. It might be a harder thing to implement if you're just starting a program and you don't have a huge presence in the community. You might have to establish that first before bringing on POL. At least that's, in my opinion. I'm not sure if it would work as well if you didn't really have that presence. As I was saying, one of the major motivations for using POL was actually the unique population we have. Nadia also works in Lynn, so she knows Lynn is a very multicultural place. That's what the sort of the focus of our work. There's a high rate of HIV, very low income, very multicultural. And what's really interesting about the gay community, it's very unsegregated. So, for example, we have the 24-year-old Brazilian guy who's roommates with a 38-year-old Filipino guy, and they're both friends with a 65-year-old gay man who lives with his ailing mother. I mean, it's really like a family. So we thought POL was going to be really effective, and it has been. As I said about the recruitment, it wasn't too difficult because we already had established these relationships with bar owners and folks. So we already knew, oh, we know this guy is the most popular guy, and this guy is the bartender. And in the end, we've had, we've been doing it for 6 years now, we've had bar owners, bartenders, bouncers, go-go dancers, regulars, HIV positive, HIV negative, Black, Latino, Asian Pacific Islanders, transgender. We've had heterosexual who are really involved in the community or at the bar. Sometimes, you know, at a gay bar there are some people working there who are straight. Lesbian women, bisexual. So it's been a very eclectic group that we've had, and we've had about 200 people who've gone through POL. And the bar itself that we focus on, 47 Central, this is the mention right there too, where we do the van, is fits probably on a really hot night, maybe 150, 200 people if they're packed in. So having done 200 people over this many years has been, you know, something that we're pretty proud of. Another way that we kind of help with recruitment is that we, the same way that these guys were talking about, we do it, the training sessions, not in the office. We do it at someone's house, apartment, right next to the bar. It's like a Tupperware party. And for that community, it works really well. People come over, Kirsten cooks this great food, and often that's one of the top ways of recruiting people. It's like, oh, you should come by. Kirsten's sausage, peppers, and onions are amazing, you know. That gets them there. And one thing that's interesting, of the 200 people we've done, I think there's a myth around, you know, that, oh, HIV, you know, everyone knows the facts about HIV. Gay men know all the facts. Probably about 90% of the guys that have gone through POL did not have the correct information about HIV transmission. They thought they did. They thought they knew what they were, but when we actually did it, we realized that this was new education for a lot of them. Successes and challenges. Like I said, we started off, we didn't really like POL because we had to rip it apart. I think what's kind of you have to do with this curriculum, it is outdated. It is from the 90s. It is sometimes even non-harm reduction based. Some of the recommendations have nothing to do with harm reduction. So we really went in and ripped out a lot of the really heavy informational parts. There's a lot of parts in the curriculum, if you look through it, that say, you know, you're supposed to stand there and say, this is how HIV is transmitted, this is this, these are the sexual behaviors. Whenever we possibly can, we get that information from the guys. So we do an HIV 101 game show, you know, where they have to answer questions, there are two teams, keeps them, you know, not tuning out. The same things with the sexual risk reduction behaviors. Instead of naming off, this is safe, this is safe, this is safe, we break them into two groups and say, all right, you guys have to come up with as many as you can in like 5 minutes, you know. And then we list those, and we talk about the pros and cons of each one. Because the epidemic is very different now than when this was written. People have different types of negotiation around safer sex. Some guys don't use condoms at all. Some are in monogamous relationships. So we try to include all of that subtle information and conversations about those things in the POL. I mean, it's not just about condom use. One of the major things that we've seen, and we've seen some of this data already today, a lot of the guys we work with and ones that have been infected through perceived monogamous relationships, often after the second date. The idea is, I go back to like the 50s when you're going steady, and it's like, when's she gonna put out, you know? And it's like, well, we haven't been going steady that long. Well, with gay men that we're working with and that we're seeing, it's when do we not use the condom anymore? How long have we been going steady? We don't have to use the condom anymore. And there's no discussion about status. There's no discussion about testing. It's just this sense of trust. We saw some of the quotes about a feeling of affection. So it is, for these guys, we're hearing this, a sense of intimacy and trust. If I love someone, they would never give me HIV. So those are some of the things that we use. Another challenge, and I'm quickly going to try to get through this, is here's a logo. Thanks. Another challenge that we've had is getting guys to do the conversations is no problem. That we teach them the basics of HIV, that we do the role playing, they go out, they have the conversations. Some of it was documenting the conversations is difficult. Another thing is that there are these elements of an effective conversation that are included in the curriculum. They're fantastic. They're one of the real assets of this. Ways to talk about HIV in a positive way, talking about your own risk reduction methods, how they work for you, giving helpful hints. But when you take a lot of guys and you train them in how to have conversations like that, communication, role-playing, all of that, I statements, use your own experience. They go out, they come back, and they say, well, I was telling him he really needs to use condoms. He better sit, and they was really focused on trying to coerce their friends into health. And often with the opposite effect. The person kind of shuts down and, like, I'm not going to talk to him about this anymore. Even though these guys were very, very popular, it's sort of like a social norm. This is how you get this message out there. And the other issue was documenting. A lot of the guys would come back with real great success stories about conversations, but actually saying, how do you know you did? Well, I think I did around 7, or I did around 15. I talked to a couple people here and there. What do you talk about? We talked about HIV, and it was hard for them to kind of focus and document that, even if we gave them journals. I mean, who's going to walk around with a journal when they're at the bar, right? So what we did do is we tried some of the logos. This was one that is a conversation starter. We had these posters that said, do you know? And then the guys wore T-shirts that said, I know. And this was developed by one group of POLs. They really liked the idea. So people would see the things and go, no, I don't, what do you know? And then that was the conversation starter. That lasted a little while. But we were still having those same issues, so we started this thing called the Success Report. And what it is literally, here's a bunch of questions. We're going to go out, we're going to interview our friends, ask them these questions, and then they're going to interview us. And then that way it's like an exchange. It doesn't feel like that I know everything, I'm going to tell you everything about HIV. It's more like you tell me what you do, I tell you what I do. It's an exchange of ideas. It's a little bit more equal. And it being assets-based, we really wanted to start off with a sense of success and get it into the idea of a positive way of looking at behavior. So tell me a recent success you've had. That can be, I got up today. What or who helped you reach this goal? My alarm clock. Does this success impact your life in a positive way? Yes, I got to work on time. So then we say, now we're going to talk about success in regard to your health. Tell me about something you've done recently to improve your health. This can be physical or emotional health. I left my boyfriend, he was a jerk. What made it possible for you to do this? Talking to my friends, they agreed, they saw the way we were together and realized, you should get out of this relationship. How does this impact your life in a positive way? Feel better about myself, I feel relieved. One health issue that has an enormous effect on the gay community is HIV/AIDS. What are your thoughts and experiences of HIV/AIDS? I don't know. I know a couple friends that are HIV positive. What do you currently do in your own life to reduce the risk of HIV infection, either for yourself or for your partners? Well, I just only sleep with guys that, that look healthy. And what helps you do this? I got a good sense of people. I know how to trust people. How does this impact your life in a positive way? Keeps me safe. This might be what they're getting back. But then the way it works is that these POLs have been trained to give very much more specific answers about what they're doing to prevent HIV. So then when they answer, they can be more explicit, like I use condoms, I keep them by the bed, this is the behaviors that I do and that I'm successful at. And so far the guys have loved this because they've covered all of the things that are in the elements of an effective conversation, and they've been able to have really even deeper conversations about what health even means to somebody, what success is. So it's always about the assets instead of coming in, what don't you do, what should you do. So now it's we're at a place where we're having a lot of success with it, and I definitely advocate this program specifically because it's so adaptable, and we've done that as much as we can. So thank you so much.